Hello dear students, welcome to my channel. So after a long time again I have come to you to give some lectures on very important topics which are going to help you for competitive examinations such as NORCET, JIPMER, NIMANS, PGI Chandigarh and even state government as well. So in that I have made a list of important topics and today I am going to discuss a very important topic, that is a chromosomal anomaly or chromosomal abnormality, which is very important topic. You can expect 1 mark from this topic. Okay. So what is this chromosomal abnormality or chromosomal anomaly? It is nothing but it is a missing or presence of extra chromosome in a cells. Okay. So there is either there may be missing of any chromosome or presence of extra chromosome in a cells. Okay. So normally human being cells possesses 44 body chromosomes and 2 sex chromosomes. So totally we have 46 chromosomes. That is a 44 body chromosomes and 2 sex chromosomes. Altogether we have 46 chromosomes in a cells of the body. Okay. So when any extra chromosomes presents in a cell, okay, and it becomes a 47, if there is a presence of one extra chromosomes in a cell, so that is turned to 47, which is known as a trisomy. If there is the absence of one chromosome in a cells, instead of 46 chromosome, if there is one chromosome is absent, then it is said to be monosomy. Okay. If there is a presence of 69 chromosomes in a cells, that is known as a triploidy. Okay. So this is all about the abnormalities of chromosomes. So now we will classify the chromosomal abnormality. So chromosomal abnormality is classified into autosomal disorders and sex chromosome disorders. So first we will have a discussion about the autosomal chromosomal disorders. So it is nothing but a body chromosome disorders. So importantly, we are going to discuss about the 3 autosomal chromosomal disorders. That is a first one is Down syndrome. So Down syndrome is also known as a trisomy 21 or Mongolism. Okay. So what happens here in the Down syndromes? The 21 number chromosome is abnormally divided into 3 chromosomes. Okay, the 21st number of the chromosomes, it will abnormally, it has to divide into 2. Instead of dividing into 2, it replicate into 3 divisions. So because of 3 replications, what happens here? There is abnormal extra chromosomes in every cells of a Down syndrome patients. Okay, so in a Down syndrome patients, when we examine the cells of the such patients, we will find 47 chromosomes totally in a cells. Okay, it is because of presence of one extra chromosome in a autosome, and that will lead to total chromosome will be 47 chromosomes in a cells. Okay, and what are the important clinical features of Down syndromes? Okay, which is also known as Mongolisms. So there will be flat face. When you see the face of a Down syndrome patient, it will be relatively flat. Okay, so flat face. Then simian crease. Simian crease means the upper limbs and the fingers are small in size. Proportion to the body, they are smaller in size, and the transverse line will be only single line. Okay, that is why it is known as simian crease. Okay, and Down syndrome patient usually mentally retarded, then growth failure. There is no proper development of the body. Okay, and the tongue will be fall out. Tongue will fall out, and usually they tend to salivate more. Okay, and there is a flat nasal bridge. This nasal bridge will be flat. And bradytactylia. Bradytactylia means number of fingers will be less than the normal. Okay, and then sandal gap. Sandal gap means there is a large gap between the first and second toe. So the first and second toe, there is a large gap between the first and second toes. Okay, so this is all about the Down syndrome. So now let us see Edwards syndrome. So it is also known as the trisomy 18. Okay, so trisomy means there is a presence of extra chromosomes. So here in Edwards syndrome or trisomy 18, what happens? 18 number chromosome is abnormally replicate into 3 chromosomes. There is abnormal division of 18 number chromosome into 3. Okay, and there will be extra 1 chromosomes in the autosomes. So because of this, the total chromosomes in the cells will be 47. Okay, that is a 45 autosomes and 2 sex chromosomes. Totally 47 chromosomes. And what are the clinical features of important clinical features of Edwards syndromes? Edwards syndrome patient will be mentally retarded and micrognathia. Micrognathia means abnormal small jaw. Their small jaw will be abnormally small. The jaw will be abnormally small. Okay, and elongated skulls. When you see the skull will be elongated. Okay, and apart from this, there will be low set ear. The ears will be low, present at the lower side. When you draw an imaginary line from the lateral canthus of the eye, it has to touch to the ear. Okay, but here it is not touching to the ear because of low set ear. There is a no touching of a imaginary line to the upper part of the ear. Okay, And next one is Patau syndrome. It is also known as the trisomy 13. Here, the 13th chromosome is abnormally divided into three parts. The three chromosomes will be divided from the 13 chromosomes instead of two. There is supposed to be two division of chromosomes has to happen, but instead of that, there will be three replication will happen. So because of this, what happens here? There will be total 45 autosomes and two body chromosomes, sex chromosomes. Totally 47 chromosomes. That is what is known as a trisomy. So trisomy is happening where it is because of defect in the 13th chromosomes that abnormally replicate a 3 copies. So because of this, what happens there is a Patau syndrome or a trisomy 13. And what are the important clinical features of this Patau syndrome? There will be microcephaly. Microcephaly means abnormally smaller size brain. And physical retardation. There is no proper growth of the body. That is physical retardation. Now let us discuss about the sex chromosome disorders. Okay. So sex chromosome disorders. Okay. Mainly we will discuss about the Turner syndrome and Klinefelter syndromes. Turner syndrome, it is also known as monosomy. Means there is abnormal absence of one sex chromosomes here. Okay. Here we are discussing about the sex chromosome disorders. So here body chromosome will be normal, but in case of Turner syndromes, there will be abnormal absence of one X chromosomes. Okay, the person will possesses 44 body chromosomes and only one X chromosomes. Another X chromosomes will be completely absent here. Okay, so that is known as a monosomy. There is absence of or missing of one chromosome, and total chromosomes of the cell is 45. Okay, and such persons are known as sterile female. Okay, usually this is a female disorders. So such females are known as sterile female because they are unable to reproduce. Okay, and the ovary is unresponsive to the pituitary gland. Okay, their ovary is completely unresponsive to the pituitary gland, and whatever the hormones secreted by the pituitary gland, such as the luteinizing hormone, follicular stimulating hormone, the ovary is not at all responsive to the pituitary hormones. Okay, and they will suffer from the primary amenorrhea. Means they will never become a and they will never attain a menarche. Okay, so they will never menstruate. So that is why known as they are a primary amenorrhea. Okay, and another sex chromosome disorders is Klinefelter syndromes, which is also known as trisomy of X chromosomes. Okay, so here, as you know, this is a sex chromosome disorders. Here there will be extra chromosomes. Okay, that extra chromosome is present in the sex chromosomes. Okay, there is abnormal one extra X chromosome is present. Okay, so that is why such person will have a 44 normal body chromosomes, and there will be XY chromosome will be there, but in addition to that, one more X chromosome will be present here. Okay, so that is known as a Klinefelter syndromes. Okay, so because of presence of X chromosomes in their cells, they are considered as a male and they are unable to reproduce. So they are unable to reproduce the children. So that is why they are called as a sterile male. Okay, and there will be the clinical features I am discussing, and they will also have a gynecomastia. Gynecomastia means abnormal excessive growth of the breast. Okay, and they may also suffer from mental retardations. Okay, and there is an underdevelopment of testes. Okay, so these are all the important chromosomal abnormality. So this is what important topic I have selected today to discuss with you. So if you like it, please press like button, and if you are a first time visitor to my channel, please subscribe and share to others. Okay, so thank you very much. I will be keep on coming more frequently in order to discuss very important topics that could help you in cracking a competitive examination. Thank you very much.